Hey everybody, it's Dr. Dave, Psychiatry. Thanks from the YouTube channel today, reminding you that if medication fixes what's wrong, that makes it a medical problem, not a mental problem. That's a basic encouragement and hope that helps you. I got a suggested comment that I do a video about a medicine called Remeron, the brand name for a generic called mirtazapine. So just quickly jumping on the channel today in the studio and throwing that on the channel and hope it's helpful to you. Mirtazapine is a medicine that's been around, again, brand name Remeron, since the mid-90s. So when it first came out, it was really marketed as an antidepressant. And in fact, it is an antidepressant medication. It is different than what we talk about, the SSRIs, the selective serotonin reuptake inhibitors, or the norepinephrine reuptake inhibitors, the medicines that if you are here and you need to be here. So the medicines like Prozac and Zoloft and Paxil, Celexa, Lexapro, those medicines that all boost serotonin from here to here. It's different. It doesn't cause the reaccumulation of serotonin through reuptake inhibition. So it's a completely different mechanism of action. The level of detail doesn't really matter in my daily professional life and probably shouldn't matter to you either. It in fact interacts with some other receptors, the alpha receptors. The point being though, it is a different mechanism of action, so it doesn't have some of the problems that the other medicines have, specifically serotonin syndrome, which is a case where if your body starts releasing too much serotonin, you can have a problem. Probably should do an entire video on serotonin syndrome, but the point is that Remeron is different than what you would think of the classical antidepressants that we use today, the group I mentioned before, the Prozac, Zoloft, Paxil, Celexa, Cymbalta. It's a different mechanism of action. Well, here's another thing that's true about it. In my opinion and experience, it didn't really work as an antidepressant. So when we started using it, and it was sort of, we were told, hey, this is going to be the latest, the newest thing, the one that you're really going to want to use. Well, we tried it back in the 90s, so we tried all things. But if it doesn't really give patients the relief they need, then you end up not using it. What does it really do? It's also, in addition to working in the serotonin as I think it's called a NASA, a norepinephrine, and selective serotonin agent, N-SSA, I think that's what it's called. As a NASA, it's supposed to interact with the serotonin norepinephrine and have antidepressant efficacy. What it really is, it's a strong antihistamine. So that's where we really use serotonin. It's off-label. It's in fact only FDA approved for treatment of major depression in the United States. But here's how most people use Remeron, mirtazapine. Most people use it as an alternate to other sleeping pills. So if there is a controlled substance sleeping pill that might have risk of abuse or addiction, and those would be medicines like Ambien, Restoril, Halcyon, the fast-acting sleeping pills that get in your system and get out really quickly, that group is pretty good for helping people fall asleep, but it doesn't help people stay asleep. Remeron, I typically use as a medicine for sleep when someone can't fall asleep, but also wakes up 3 hours later. So if you have a hard time falling asleep and staying asleep, Remeron is a really good tool. And because it's a different mechanism of action than Prozac, Zoloft, Paxil, Celexa, Lexapro, you can add mirtazapine, my opinion, easy to do it all the time, add mirtazapine, Remeron as your sleeping pill for a patient who is struggling with sleep at the same time that they're struggling with mood. So if I've got a patient that's taken Prozac or Zoloft or Paxil, and their mood is better, interest levels better, energy, hopefulness, concentration, ability to do their daily stuff, if that's better, if I've taken their serotonin from here to here with an agent like Prozac or Zoloft or Paxil or Cymbalta, but they still have a hard time sleeping, then a lot of times I will add mirtazapine to that program because they're two different mechanisms of action. It's not a problem. It's like ketchup and mustard on a hot dog. You can have both. It's not a problem. So the ability to take those medicines, obviously, you want to, anytime you take a medicine, you want to make sure that you don't have side effects. So when I say it's not a problem, obviously that's an individual case-by-case basis, but it would not be something I'd be averse to trying and starting somebody as a sleeping pill if that's what they're asking for. Principally the target of not just not being able to fall asleep, but not being able to stay asleep. So the dosing on Remeron, mirtazapine, is interesting. They make a 15, they make a 30, and they make a 45. So you can take that dosage range, whatever, but it turns out a lot of people are actually more sedated with the antihistamine effect on lower dosages. And there's reasons behind that that are biological, which you don't have to get in here today. But the point is that sometimes with Remeron, you actually don't go higher to help people sleep more. I typically start at 30 with adult patients of average body weight. And if that doesn't work very well, actually go backwards. I'll say try taking 15. And sometimes you could actually just start with 15 and bust those in half and just take a 7.5 to see if that helps. So a lot of people take the lower dose. That's not a problem taking the higher dose, but just because of how the antihistamine works with this particular medicine, sometimes less is more. That is to say, a lower dose is more sedating to help people sleep. It's pregnancy category C, which means if you're pregnant, there are animal studies that suggest that there could be problems in humans. There are no controlled studies, so we don't really know. So it's category C. If it helps you and that's something you decide that you want to take during pregnancy, discuss that with your doctor. And as with most medicines, I don't personally tell people that they should be taking it if they're breastfeeding. That's something that you can talk about with a doctor who is a breastfeeding specialist. Neonatologist typically is the one that would answer that question if that's a specific question that you have. In my office, I say, check with your OBGYN if you're going to breastfeed. I typically don't recommend it because it's possible that the medicine concentrates in breast milk. So those are my thoughts on mirtazapine, Remeron. It is a great medicine in the right application. For a lot of people, it is a better tool than a sedative hypnotic, even the fast-acting ones. And it is certainly a good addition for a medicine that when you really want to help somebody not just fall asleep, but also stay asleep. That's the real power of Remeron, mirtazapine, is that if you have a hard time sleeping, but then you take something that helps you fall asleep, but then you wake up at 3 in the morning, mirtazapine is really a preferential tool for helping people not only fall asleep, but also to stay asleep. So those are my thoughts on Remeron mirtazapine. I hope they're helpful to you. Thanks for coming to the channel today. I'm glad this is helpful to a lot of people. I continue to plan to keep doing it. So I'm Dr. Dave Psychiatry. Thanks for coming to see me today.